kind of mood are you in? When it comes to work, factors including age and gender seem to influence that answer, and ultimately the benefits we enroll in at work. Here to take us through the results of a new Mood of America survey, Eric Reisenwitz, Senior Vice President of Lincoln Financial. Good morning, Eric. How are you?
Good morning, Mike. I'm fine, thank you.
Great. What were some of the key findings of this newly completed survey?
Mike, the survey found that generally most American workers are generally confident in their financial future. However, only 18% felt that they would be able to meet the financial burden if something should occur to them with respect to an injury or an illness that could prevent them from either working or meet medical expenses.
Yeah.
We did also see some positive news in that, however. When we looked at employees who took the opportunity to enroll in some non-medical benefits, benefits like accident insurance and critical illness insurance, benefits which employers offer and which have the opportunity to close some deductible gaps or other gaps people may see in their financial needs during a time of accident or illness, people who bought those benefits were much more optimistic about their financial future.
Yeah, but there are these differences in optimism. How do you explain those differences?
Yeah, we did see some differences in optimism. For instance, generationally, 67% of baby boomers do have a financial plan. That's a good number. There's room for improvement, but it's not bad. Skipping a generation going to the millennials, 55% of the younger generation of workers also have financial plans. The concerning generation is the Gen Xers, those workers between the ages of 35 and 50. Only 44%, less than half of those individuals have financial plans. So that's a little bit concerning when we think about, the need to have both benefits taken care of today and tie that into your future financial security planning. We also found women were confident and optimistic about the world they live in today, but were very concerned about their ability to meet costs, particularly healthcare costs, as they move towards retirement.
Yeah, planning for their future, we hear that emphasized all the time. And people are confident. They're confident about covering healthcare costs today, but in the future, not as much. Why is that?
Yeah, we saw the same thing coming out of our survey. We believe a lot of it is tied to healthcare costs continue to increase, while individuals still are thinking about, what could possibly happen to them. And they do feel that healthcare costs are going to dig deeply into their ability to retire as they would like to do. Sometimes it's tied to income and healthcare cost. Sometimes it's tied to their focus on certain diagnoses or concerns that they have about what could happen to them. Cancer ranks among the highest concerns individuals have, both in terms of a diagnosis as well as an individual's ability to afford coverage, treatment, and ability to live during any type of recovery period.
Yeah, I got a question for you relating to those of us that have benefits at work. What's your advice to people who are navigating all those benefits at work?
I'll give you the same advice, Mike, that I gave my daughter a few years ago when she graduated from college, went to work for the first time. She came home with her enrollment kit, asked what to do. I said, you need to understand what's available from your employer. Dig in and check into the benefits that are there. Understand what's available beyond healthcare. Look into disability, dental, vision, and benefits along those lines. Once you do that, take assessment of where you think your priorities rest. What would happen if you couldn't work? What would happen as you think forward and think about families and mortgages and things along those lines? Marry the two together and try to understand what's the best fit for you. And I'd give that advice to anybody.
Sure, that makes sense. What about employers? What can employers do to help educate their employees on the other side of that?
Yeah, employers want their employees to feel confident that the benefits packages that they offer and the benefits employees choose are solid benefits. Most employers offer an open enrollment period once a year that allows employees to go in and update their benefits to their current needs. Around that time frame, you will see information on their websites. You may see benefit fairs, enrollment forums. You may have counselors available for individual employees to speak with. Employers will do a lot from a best practice perspective to make their employees knowledgeable. They'll also have opportunities such as going to our website at lfg.com/GP employee benefits. Also gives you a sense as to what you can think about and what you may be able to get from your employer.
Yeah, all good topics. Not everybody understands this stuff, but I think it's important that we cover it. Again, that website, if they want more information.
Absolutely. lfg.com/GP employee benefits.
All right. Thank you, Eric. Appreciate your time this morning.
Thank you very much, Mike.
Yeah, Mary, over to you.